You would agree with me that most women don't even know if they're ovulating or not to talk of the actual date the ovulation happens or occur. And ovulation is the key factor that determines fertility, if a woman is fertile or not. It is what makes one a woman. Because without ovulation, without one ovulating, it is scientifically impossible for a woman to get pregnant. It is a period, ovulation is a period when a woman releases a mature egg from the ovary that could be fertilized by a viable semen from your partner. You can see how important ovulation is, especially for those that are trying to conceive. In this video, I'm going to be explaining all you need to know about ovulation, the signs and symptoms that you're ovulating, factors that could affect ovulation, and also I'm going to be explaining some tests that you could run to determine that you're ovulating. And also lastly, I'm going to be explaining or giving those things that could boost your ovulation. So you may want to sit back, relax, and watch the end of this video. Guys, if you're ready, I'm ready. Let's get started. So as I said earlier, ovulation is a period where a woman releases a mature egg from the ovary that could be fertilized. That is for those that are trying to conceive. It could be fertilized by a viable fertile semen. Let's look at those signs and symptoms that will make you know that you're ovulating. And you agree with me that the reason why some people don't even know they're ovulating is because they don't monitor their body. They don't even know how their body functions. They don't even know how your body works. So if you're one of those, I would like to encourage you to begin to monitor your body, monitor your system as a woman. It's very, very important. So for those that are trying to conceive, let's look at the signs and symptoms that you are ovulating as a woman. So the first sign is regular menstruation. Yes, menstruation is very, very key. It's on that thing that makes one a woman. When you're having regular menstruation, and what is regular menstruation? It is a menstruation that falls between the cycle length of 21 days to 35 days. If your cycle length is above 21 days or out of 35 days, you know that you're having an irregular menstruation. So when you have a regular menstruation between 21 to 35 days, it's a sign that you are ovulating. So another sign that will make you know that you're ovulating is cervical mucus. Cervical mucus is on that thing that determines or makes you know that you're ovulating. Before ovulation, the cervical mucus will be thick, white, and dry. But during ovulation, the cervical mucus is slippery, stretchy, and clear. So when you see such cervical mucus, that should make you know that yes, I must be ovulating or I'm ovulating. So that is the second sign that will show that you're ovulating. Another sign that should make you know that you're ovulating is increased libido. What I mean by increased libido is high sexual urge. When you're ovulating, there's a tendency that you have this sexual urge. But if you are single, please, this is time for you to zip up and hold yourself. But for the married, you are free. And for the singles, you wait for the right time to avoid unwanted pregnancy. So when you have this high increased libido at that period, it's a sign that you might be ovulating, or there's high percentage that you're ovulating. So another sign that should make you know that you're ovulating is sensitive breast. When your breast is sensitive, you feel this little pain sensation in your breast. You should know that yes, it is on that sign that should make you know that you might be ovulating. So another sign that shows that you're ovulating is when you experience cramp. You know this menstrual, when you are having menstrual cramp, just similar to it. When you have cramp during that period and it's not your menstrual period, you know that you might be ovulating. Another sign is that when you feel like vomiting, so you think you are pregnant, it's another sign that you are ovulating. So let's get to the next thing, which is some tests that could tell you or that could make you know that you're ovulating. There are some tests you will run. You will know that yes, you're ovulating. Maybe you want to be double sure that you're ovulating. So I'm going to mention two tests. There are other tests, but these are the two tests I'm going to be mentioning. The first one is ovulation prediction kit. It's a prediction kit that shows that you're ovulating, just like pregnancy pregnancy strip that you use your urine to test. It's the same thing. During that period of ovulation, after your period, after maybe 10 days, you begin to test for your ovulation. When the LH, when it skyrockets, when it's high or it's positive, you know that the probability that ovulation is about to occur, and you begin to have intercourse. Normally between 12 to 36 hours before the ovulation occur, it surges in your blood and it goes high. So that is one of the test kits you could use to know if you're ovulating. You could get it in any pharmacy store, even online you can get it. So on that test you could run to show that you're ovulating is hormonal test. Yes, hormone test you. It's on that test that will confirm that you're ovulating. When your FSH or LH is okay, you know that yes, you're ovulating. Because when your LH, that is FSH, which is follicle stimulating hormone and luteinizing hormone, is low, you know that there's probability that you're not ovulating. Because follicle stimulating hormone is the hormone that stimulates your follicles. Follicle is the egg, where the egg comes out from. So when your follicle stimulating hormone is low, how will the egg come up? How will it stimulate the follicle? which is where the egg is. When your FSH and LH is low, you know that yes, there's probability that you're not ovulating. But when your FSH and your LH is high, you know that okay, there's probability that yes, this woman or this person is ovulating. So there are various factors that could affect ovulation. One of it is hormonal imbalance. I'm going to be leaving the link up here. I made a video about it. I'm not going to be going into detail. You can go there, watch the video, and learn more about hormone imbalance and the best way to tackle it. Another factor that affects ovulation is polycystic ovarian syndrome, when a woman has more male hormones than the female hormones, and that is PCOS. And we also have premature ovarian insufficiency. Another factor, age. A lot of factors that affect ovulation. So let's look at those things that can boost your ovulation from 0 to 100. But before I continue, if you're yet to hit the subscribe button, please do not forget to hit the subscribe button, be part of the family, and also do not forget to turn on the bell icon so you get notified whenever I post any new video. So one of those things that can boost your ovulation from 0 to 100 is Overcare. Overcare is a good ovulation booster. I've used it and it worked for me. It can boost your ovulation. Another one is Ovulon. It's also a good ovulation booster. Another ovulation booster is Clomid. I know you must have heard of it. Another one is Letrozole. But remember, you need to seek your doctor's advice before you use any drug. Do not self-medicate or any medical practitioner to guide you on how to use these drugs. The interesting thing is that there is a way out of every situation. You just need to see your doctor, do the necessary check you need to do, observe your body, and also take the necessary medications you need to take, and you'll be fine and be okay. So guys, I'm going to be ending the video here. If you did enjoy the video, please do not forget to give the video a thumbs up, and also hit the subscribe button, turn on the bell icon so you get notified whenever I post any new video. I'm going to be in the comment section discussing with you and reading your comments. Thank you so much guys for watching my video. I remain Clara. See you in my next video. Bye for now.